I now call on Deputy Kate O'Connell. You have 10 minutes, Deputy.
Thank you, Ceann Comhairle. I believe this motion is perhaps one of the most important to come before this House in recent times. How we fund, govern and manage our health services over an extended period of time may be the most useful initiative that has been taken by any government in the last 30 years. And it presents us with a unique opportunity to challenge forever the way we address our health needs as a society. We have 10 years to save a generation. Devising cross-party agreement on the direction of health policy in Ireland will hopefully give long-term clarity on funding, staffing, contracts and the hospital network organisation. I hope it will also remove opportunities for political opportunism that prevent us from making good decisions about where to allocate resources. It is vital that there is a recognition of the impact of socio-economic deprivation on health. Now that we are finally entering a period of relative economic stability and growth, I believe that there is scope to address the inequality of access that exists for service users, and that this committee will move to establish a universal, single-tier service where patients are treated on the basis of health need rather than on the ability to pay. We are moving towards being the most obese country in the world if we do not change course. We have an emergence of food poverty where there is an inability to afford or to have access to a healthy diet. Low-income households, due to a combination of lack of money, education and access, have diets made up of cheap, poor-quality, calorie-dense foods with little nutritional value. This is the root cause of the spiralling obesity epidemic. Obesity is a risk factor in 4 of the 5 biggest killers in this country, and it affects all sectors of society, but disproportionately the poorest people. We have the lowest breastfeeding rates in Europe. We are witnessing a battery-fed population. There is a generation coming on stream that will for the first time live shorter lives than their predecessors if we do not intervene. Cancer mortality rates in disadvantaged areas are 3 times higher, and it is the second most common cause of death. Patients in disadvantaged areas often struggle to manage these conditions while facing other social and financial pressures. People who are most likely to die have the least access to health services in this country, and this is fundamentally wrong. This happens when services are distributed according to number and not need. If you have the same number of services, for example, per 1,000 people, regardless of where they live, those in the most disadvantaged areas effectively get half the service, as they are twice as likely to get ill. In relation to primary care, there is not even the same number of doctors per head of population in disadvantaged areas. The average ratio of GP to patient is 1 to 1,600. In the northwest of Dublin, which has 3 times the average cancer death rate to the most affluent area, the ratio is 1 to 3,600. Public patients from that region will wait 11 months for vital tests diagnosing cancer, where in the southeast of Dublin it is 2 months. I represent the southeast of Dublin, and I consider 2 months an outrage. So what do the people and the TDs of the northwest of Dublin think? As a student, I worked as a hospital cleaner and a ward aide in Tullamore Hospital in order to pay my way through college. Upon qualifying as a pharmacist, I worked as part of a multidisciplinary team in the NHS, alongside hospital consultants, nurses and physiotherapists and others, to enable a clear pathway to recovery for each patient on a case-by-case basis. The NHS, believe me, is by no means perfect, but we must look to them and learn from their successes and their mistakes. We have an opportunity here to replicate all that is good in other countries' health services while tailoring it to our needs as a nation. Everyone in the health system, from consultants to the cleaner, are working for the best outcomes and to deliver the services that patients require. We have gone to great lengths in this country to set up hospital networks, yet these networks are not functioning coherently, either for emergency or for elective care. In a network where the primary care sector channels patients towards the major hospital in a region, then that network as a whole should be responsible for the hospital-based care of its catchment population. Unless they have a clear idea of who they have responsibility for, specialists in major hospitals cannot plan and deliver their service. Patients should therefore not have to cross hospital network boundaries in order to access care they need, other than in cases where the service they need is not available in their own network. We cannot remain in a situation where we don't know what we have, where it is, and who's in charge. We have ended up in a situation where the quality of outcomes has been compromised because patients from all over the country are arriving at hospitals that have neither the clinical nor the financial resources to deal in a timely fashion with the volume of patients coming through their doors. In a recent conversation with a consultant surgeon, he described the dangerous deficit of theatre capacity to me in the major specialist centres, including our children's hospitals. He told me how common it is that young, healthy patients suffer needless long-term disability as a result of delays of access to theatre. He described the service as irresponsibly inadequate. Apart from the lifelong harm that individual patients suffer as a result of these challenges, there is the economic cost that runs in tandem to the human cost. As patients wait, occupying beds, waiting for delayed treatment, their conditions deteriorate to a point where they require extra operations to deal with the consequences of a totally avoidable infection. We need to accept that illness doesn't take the weekend or the evenings off, and in order to provide the best outcomes for people, we need to recruit skilled staff. Good outcomes depend on the whole team being involved in a patient's care in a routine, organised and regular manner. This simply doesn't happen in Ireland, as there has been a noticeable loss of expertise in the system, coupled with poor resourcing of our hospitals, worsening terms of employment for the staff and improper planning when it comes to administration. Delivering local, accessible health and social services in the community to a defined population should be the cornerstone of any progressive health service. We cannot continue to depend on the goodwill of healthcare professionals in the primary care setting to advance this area. Investment in primary care as a unique entity is required, as those of us who work in the community setting currently see it as an add-on to our role. And all evidence suggests that for every €10 spent in the primary care area, it would save €100 in cost to the state in the long run. Introducing a functioning and universally employed IT platform would greatly enhance efficiency and communication. It would decrease the current paperwork load and speed up the process from point of access to the point of delivery and on to aftercare in the community. Primary care remains underutilised and undervalued. Morale is on the floor, and this committee, once formed, will need to address the concern and confusion that exists regarding the future of primary care in this country. Now is the time to create a vision for that future, while there is still the willingness and the energy for healthcare reform amongst the wider healthcare community. I believe not one day has gone by in the last 15 years where I have not spoken to multiple people involved in the provision of healthcare as their job. Everyone engaged in active healthcare provision wants our system fixed. There is a passion to deliver a world-class health service amongst these professionals, a passion driven by a fundamental desire to improve people's lives. In light of the recent tragic events in Cavan and in Holles Street, I think it is imperative that the National Maternity Strategy is implemented as a matter of urgency. This strategy, where the patient is the central focus in the delivery of maternity services, is long overdue. If the patient is not the central focus of care, well then who is? I could stand here all day and list the inadequacies of the services and perhaps try to assign blame to those who I believe contributed to getting us to this crisis situation. But that would be political opportunism, which would neither be constructive nor of any benefit to the thousands of citizens requiring adequate care right now, as we sit here fit and healthy. I hope today we have a platform to have a new dawn. Today we have a chance to be part of something constructive, not destructive, and to collectively face the challenges and save a generation. It was with great hope that I support this motion that Minister Harris and Deputy Shortall have commended to the House, and I urge all deputies of all parties and none to unite in supporting it. Thank you, Ceann Comhairle.